Welcome coach ball hapa relax. Kuza pressure. Hey Buda. Sema kitu. Pesa ni jua moto manze. Kuna joto manze sama. It's very hot. Mroka Kenya wapi? From Kenya?
From Kenya, but I stay here in Cafe.
This is where you work?
I come to
Okay. What brought you to Kenya? Or what brought you to news? What brought you to China?
Then I came for study.
Which university?
Musonye Medical.
You're a doctor? Amazing. So how many years?
Now I completed my studies. Now I work there postdoctoral research.
Okay. My sister is a doctor.
Okay.
Yeah, no, at home.
Okay.
I've been trying to encourage her to come here and try,
She's a bachelor's doctor or
doctor? Bachelor's. More.
She can come and do a postgraduate study. In our university.
Tell her something. Let me see.
If she needs to apply for postdoc, postgraduate studies, she can come join our university, Musonye Medical University.
Okay.
Yeah, we have very many programs in postgraduate studies. Yes.
What's your specialty?
Personally, I'm a research scientist in molecular epidemiology.
Wow.
Yes, so I'm doing my postdoctoral research in molecular epidemiology. Specifically, I'm looking at rheumatoid arthritis.
Wow.
Yes.
This through the knees?
Yes.
Okay.
The inflammation of the joints. Basically, it's the inflammation of the joints.
That's amazing.
Yes.
And I saw from research that the medical science here,
yes,
technology rather, is way ahead.
Yeah, basically China is leading in terms of medical technology.
Yeah.
Yes, they are the leading, because if you look at the kind of infrastructure, recently we saw a Chinese medic was able to work on a patient in Shanghai from Italy.
I saw that. Yeah. By the surgery.
Yes, you see,
wow.
he was a Chinese trained doctor. Yes, so basically, then Chinese, they are the leading in terms of medical equipment, production and manufacturing of medical equipment. Currently, they are the leading in the whole world.
And the pay here is great.
Yeah, the pay is good comparatively to other countries, and then also the cost of living in China is low.
Okay.
Yeah, it's not like we call them the European cities.
Yes.
Like China, we don't have so many European-like cities.
Yeah.
Maybe you find like if you are in Shanghai, Beijing, or maybe Guangzhou, is where life may be a little bit high.
Yeah.
But in other cities like where I stay in Hefei, it's a normal life.
It's Hefei far from you?
No, it's 3 hours by train.
So you came all the way just for this?
Yes.
Wow, okay.
So it's in terms of living, China is better if you compare the salaries across the world, the developed countries.
Yeah.
Like someone working in UK and someone working in Hefei, where I stay, doing the same job, earning the same salary. Someone in Hefei is going to save a lot compared to someone working in London or maybe New York.
Okay.
Yeah, so that's the better part of China. And then also in terms of security, safety, I mean. Yeah, you see, China, you can walk 24 hours on foot, by air, on road. Yeah, it's very safe.
I've seen most scholarships that are given to people in China.
Yes.
That you have to be under 35. Most scholarships.
No, that's now. No, it depends. But under 35, maybe it's always under 35 male and then under 40 female in most scholarships. But others can even take up to 40 years.
Really?
Yeah, male. But what normally they put a lot of restriction is basically on postdoctoral research. When you want to do postdoctoral after PhD, that's when they give a lot of restriction on age, because they only want to support early career researchers, which includes people below 35 years. So if you want after your PhD, and now you want to go into postdoctoral studies, they always pick below 35 years in most cases. But in some cases, you'll get even 40 years, you'll be allowed. And then basically, if it's your first postdoctoral position, the age limit is 35.
Yeah.
But your second postdoctoral position, you can even get even in 40. And then another area where they may relax age is maybe in a hospital environment, where you want to go and do your postdoc in an hospital. They may relax your age even up to 40 years. Yes.
Wow.
So that's basically what happens.
Because I'm thinking of moving here even for a few years.
Okay.
When you're in Kenya, you feel like your potential is being wasted.
So you are here on a short visit?
I came here for business.
Okay.
I sell things in the gym industry, gym equipment.
Oh, gym and sports.
Gym.
Okay.
Yes.
You have a gym in Nairobi?
Yes, I have a gym in Nairobi.
Where specifically?
Kawaskari, think of Kawaskari.
Yeah, because I'm Kawaskari.
Yes.
I used to live in Kahawa also.
Wow.
I used to train. There's a gym there. There's some gyms in Kahawa there. I used to train there.
You know Body in Spirit?
I trained in. I used to train in KU when I was a student, postgraduate. And then I also trained at Kahawa Wendani. There's some gym near Magunas.
Magunas.
There was a gym. Yes.
That's the gym.
I've been there. I've been there.
But that was before I joined them.
Okay.
Yeah.
I've trained there. I
belongs to my uncle.
Okay.
When I moved to Kawaskari, then I joined him.
Okay.
Yeah,
because I used to live in near there, behind a few meters from Magunas.
Which year was this?
That's from 20. I stayed there from 2017 to 2022. Early 2022. Then mid 2022 I left. I came to China until now. Yes.
I've been thinking, when you go into business,
yes,
and when you get used to the money, you sort of push education to the other side.
Oh, so you relax a little bit.
I relax a little bit.
Yes.
Then just focus on the business.
Yes.
But now I think if I continue focusing on the business,
yes,
I will never go back to school.
Yeah, because if your business has picked, then you can give other people you can delegate the duties and concentrate on studies.
Yes.
Because the knowledge and the money it's all people, human beings are chasing.
Yes.
You are either chasing knowledge or money.
Or money, yes.
Yeah. If you are not chasing either of the two, then I don't know.
It's true.
So it's either knowledge, money, and knowledge brings money and money brings knowledge.
It's true.
You can use money to get knowledge.
Yeah.
Use knowledge to get money.
It's true. It's true.
Yeah. Is that how it works?
That's how it works. It's a balance.
Yes.
Yeah.
So it's a balance.
Yeah.
You've seen billionaires going back to school.
Yes.
And you've seen poor people going to school, chasing.
Yes.
Yeah. So that's how it balances.
It's true. It's true. What were some of your challenges here in the past years?
Okay, I think one of when I came first, because I came during winter, so basically the winter thing, because in Kenya we don't have winter, so it was very difficult. But you see, personally in life I adapt so quickly. Yeah, so I got adapted to the winter things, and then language barrier, it was not so much, but because of technology we can translate. Yes, we can translate and maybe understand when you go to before you are taught the Chinese language. And then maybe another issue is food. Food is also, because you find it will take time to know where there is ugali. Yes, it will take time to know where you can buy sugar and have the Kenyan tea. So, but because we are living in because of technology, I mean, we get to, everything is online here. You get to understand where you can buy what, and then you adapt very fast.
And the culture shock.
Culture shock is about what I've talked about, food. And then maybe another issue is these things of greetings. You see, I came from Nairobi, we are used to shaking hands. Now you come here, you stretch your hand to a professor and he doesn't respond. Then you are left hanging like. Until you get used to now, even when I meet like you now, even I don't stretch my hand. Yeah, because now at least I've used to those things. But at least it was very difficult at first because we are used to greeting. And then students, the Chinese students, they also don't greet, they even don't hug, and we are used to that in our Kenyan campuses. So you come here, you want to hug someone and they're not responding. You want to shake hands, they're not responding.
You think it's personal?
But it's not personal. And then also they are not social even among themselves. In an institution environment.
Yeah.
Now I'm talking about institution, in school environment. Yeah, because guys are in a medical school, guys are busy.
Yes.
Guys are so busy, like people have no time. It's books, morning books, evening books. Yeah. So you'll find like you have some little time with your friends, Chinese friends.
Yes.
Just hi.
But it was worth it. How many years worth it?
It was what? In fact, I advise most guys back at home. I tell young people, China is the future. In terms of research.
Yes.
Yeah. If you want to do research, because there's a lot of money for research. Around.
Okay.
Yeah. Like professors are given a lot of money. For research.
Okay.
Yes.
Wow.
So when you talk about your sister, if she's willing, she can apply when the scholarship opens. Yeah, then she joins.
And how about therapists and the psychology field here?
Yeah, psychology is I've not interacted with the psychology things, but for the little time I have to learn about it or to interact with them. I think they are taking, because like in our university, when you want to get employed, we have even special psychologists. They don't just employ you. You must go to there, they vet you. Anybody before you are employed. It's like in Kenya when they say, where in court where they say you have to go to Mathare for them to know if you are okay before the proceedings. So same way before you are employed, you have to go to those guys also. They check mental checkup. So that tells you how serious they are in that field. Wow.
Regarding the scholarship, did you get your scholarship while in Kenya, or did you get the scholarship here?
No, while in Kenya. Yeah, because I was doing immediately after my MSc. I just started applying. So I got five PhD scholarships. Five PhD scholarship interviews. Interviews. Then I attended interviews, some in German, Spain, USA, and then here the China one came through. So
5 scholarships.
Interviews. Yes.
For different countries. Wow, you are very smart in school, eh?
No, not necessarily smart in school. I put a lot of effort in applying for the scholarships.
Okay.
You see, you can be smart in school, but you see, if you don't apply correctly, then you won't get it. And then you see, these things of scholarship, it goes beyond the A's you score in a undergraduate. Those A's, it goes beyond that. Because the language we use in research is different from the language you speak. The English you speak on the street is different. So what you want, how you develop your hypothesis and all those things. So it's very different. So what made me to get 5 PhD interviews, scholarship interviews, I applied more. So you see, the more you apply, the higher the chances. Yeah, because after my MSc, I did a lot of application. So I was being invited for interviews, but initially I didn't have in mind like I want to go to China. By the way, my main focus was in German. I really admired to study in German. Because initially, before, when I was undergraduate, I was looking at the country statistics, and German was rated among the best with the highest number of PhD holders. German as a country. So when I was in undergraduate, so I was like, hey, and then they were saying German teachers are highly paid in the world. Those times. When the economy was doing very nice. So I was like, I developed that in the mind that I must go to German for my postgraduate. So I was applying. In fact, my first PhD interview I was called in German, Hanover Medical University. But then it didn't go through. We were shortlisted 6 guys, and then they picked a lady from Spain. Who qualified. So it was a very good scholarship in terms of stipend. You see, we look at scholarships in terms of stipend, how much you are going to earn, and then maybe the project you are going to do. Because the project was to develop TB vaccines. Which is a very, which has a lot of interest in the current research. So I didn't qualify that. Then other Spain, where then the Chinese one came through. Then I had to come here.
So you had done masters in Kenya?
Yeah, I did my masters at Kenyatta University. I undergraduate at University of Nairobi.
And what did you choose for your masters?
I did medical microbiology.
Medical microbiology. Then now you came to PhD
in molecular epidemiology.
And now after
Molecular epidemiology and health statistics. That's a PhD. Then after that, I'm doing molecular epidemiology in a postdoctoral research.
What does that mean for the common man now? How can you explain that?
Molecular.
Yes.
So we are looking at the epidemiology at molecular level, at cell level. Yes, the cells and the body cells. You see, like the DNA, cytokines, macrophage, all those things. But then, because it's a epidemiology, then it is going to include, epidemiology is a wide field. It includes immunology, it includes you can call the microbiology way, the immunology way. So it is a diverse area, epidemiology. So then I choose the molecular. So when as I say, I'm looking at the rheumatoid arthritis, but under molecular epidemiology, I'm just simply looking at how rheumatoid arthritis starts from the beginning, how it starts and how it ends at the end, and what are these factors that influence, what are these cells that are involved, the immunology cells, what are these physiological body changes that happen, what are the pathways, that what we call pathways that lead to that. So basically we look at the pathogenesis and all the factors that are involved in that pathogenesis, and up to until when your joints, inflammation happens in your joint, maybe you become unable to move, and all those kind of things. But epidemiology as a subject or as a discipline is very wide. You see, you can do even epidemiology can be even in other things like the medical now, the medical things. You can do in environment, epidemiology. You can do in so many areas. Simply means you track the process of something. Yes.
Wow, that's fascinating.
Yeah. So molecular is one of the top most level of research we can, because it helps in coming up with what we call specificity in maybe development of drugs or management of diseases. When you understand a disease from the molecular level, then it becomes very easy to manage the disease, to develop drugs and all those things for the same disease. Yes.
Wow, that's fascinating.
Yeah.
So medical research is your passion?
Yeah, that's what I do. Yeah, medical research, unless something else comes up that will be better than that. But as for now, it's medical research. That's what I do.
Wow.
Yes.
Now you can introduce yourself. I forgot to ask about your name.
Okay, I'm Dr. Musonye Hari Asena. I'm a postdoctoral research fellow at Hanhui Medical University in Hefei, China.
Amazing. I'm Charles Monica. I'm a businessman.
Okay.
Yes.